This video was originally designed to be used in our clinic during an office visit. You may simply watch the video for general education, or if you plan to use this in preparation for an upcoming wellness exam, you may print out the handouts and checklists mentioned in the presentation. These are found in the Patient Education section on the website homepage. Please note, this video contains pictures of adult sexual anatomy used to explain cancer prevention health services. This may be too sensitive for younger children, and parental or caregiver discretion is advised. This video was produced on behalf of your healthcare providers at the Center for Family and Preventive Medicine, Dr. Henderson, Dr. Roach, and nurse practitioner Patricia Henderson. Among the most valuable healthcare benefits available to you are those that prevent or lessen the harm of serious disease. One of our important roles as your healthcare providers is to help you understand and take full advantage of these benefits. Thanks to advances in medical science, a number of serious and potentially life-threatening diseases can be prevented or at least diagnosed at an early stage. This can make the difference between a long and healthy life and a life that is needlessly shortened or burdened with disability. A simple test or procedure can often prevent a lengthy and costly hospitalization. In the case of cancer, preventive services may eliminate or reduce the need for chemotherapy, radiation, or surgery. An added benefit is to lessen the financial burden you may have with a serious illness. As your primary healthcare providers, we strongly recommend that you take advantage of the best healthcare available today by putting preventive medicine at the top of your healthcare priorities. The remainder of this video will present information on the major preventive services that we encourage you to consider. These are tailored to your age and gender. This information will be updated at least annually to ensure it is correct for your age and based on the best scientific information available. Therefore, we shall ask you to review this periodically in conjunction with one of your office visits. The topics covered today will be screening for cervical cancer, the influenza or flu vaccine. We'll also cover screening for depression, tobacco use, and touch on the important subject of advance directives. Your medical assistant will provide you with additional handouts that give you an important set of information on preventive matters not covered in this video. This includes immunizations not provided in this clinic, injury prevention, nutrition and exercise, substance abuse, safe sex, dental health, skin health, and CPR training. The cervix is the lower part of the female uterus. The green arrow at the bottom left points to a picture of a normal cervix. The red arrow at the top right indicates a graphic of a cervical cancer. From left to right, this shows cervical cancer advancing from early to late stages. Cervical cancer can be prevented or at least detected early and treated successfully in almost all cases with regular pap smears. A major contributing cause for cervical cancer is the human papillomavirus or HPV infection. There is a vaccine for HPV that can prevent cervical cancer. It is given in a series of 3 doses and is currently recommended for women under 27 years of age. Pap smear recommendations for women with a uterus are every 1 to 3 years if you are at average or standard risk, and every year if you are at high risk. Among the factors relating to high risk are the presence of a high-risk HPV infection, abnormal pap smears in the past, or multiple partners. Pap smear recommendations for women without a uterus are, if there was no cancer with your hysterectomy, you may stop getting pap smears after 3 consecutive normal pap smears. If there was cancer with your hysterectomy, you should continue to get pap smears every year. Please note, if you do stop getting pap smears, it remains important to have regular well women exams to check for breast and ovary conditions and other issues associated with a well woman exam. Breast cancer screening typically begins at age 40 unless you have a mother or sister with breast cancer or you have a family history of one of the highly malignant types of breast cancer. Colon cancer screening typically begins at age 50, unless you have a mother, father, brother, or sister with colon cancer, or you have a family history of one of the highly malignant forms of colon cancer, such as familial polyposis. Vaccinations are among the most underutilized of adult preventive services, and this deficiency is the cause of an estimated 60,000 preventable deaths in the United States each year. Today we shall discuss the influenza or flu vaccine. There are many myths and misconceptions about this vaccine. The following information is based on the best scientific information available. The first myth is influenza is not a dangerous disease, and the truth is influenza causes 36,000 deaths per year in the United States. It also causes over 200,000 hospitalizations. Another myth is the flu vaccine causes the flu, and the truth is the vaccine cannot cause the flu. This is perhaps the most common reason this vaccine is not taken. Remember, it does not cause the flu. If you got a flu-like illness in the past after taking the flu vaccine, it was likely a bad coincidence and not caused by the flu vaccine. Please do not let this misconception keep you from getting a vaccine that can literally save your life. The next myth is the vaccine is dangerous, and the truth is the flu vaccine is very safe except for persons allergic to eggs or having a history of a serious true allergic reaction. Signs of a true allergic reaction are lip swelling, breathing difficulties, or a choking sensation. The final myth is the influenza vaccine is not effective, and the truth is the influenza vaccine is very effective, with up to 70% reduction in hospitalizations and up to 85% reduction in death from flu in vaccinated adults. The bottom line on the flu vaccine is get your flu vaccine, unless there is a real medical reason not to do so, and this is actually very uncommon. You should also review the immunization schedule and the handouts given to you today, and be sure to get all recommended adult vaccines as indicated in that handout. Depression is a very common mental health condition that causes a great deal of human suffering in terms of decreased quality of life. In its most severe form, it can be fatal as the result of suicide. Depression can be easily detected through a simple questionnaire, and the available treatment is safe and effective. Tobacco use is the leading single cause of preventable premature death and disability in the United States by causing lung disease, heart disease, and cancer. There are now very effective treatments available that can help motivated smokers to quit permanently. A final area we wish to present deals with the important issue of advance directives. These are legal documents. You use them to leave instructions for your wishes regarding your health care in the event you are unable to do so. There are two major forms of advance directives, the healthcare proxy and the living will. The healthcare proxy is a document that names the person who can carry out your healthcare decisions if you are unable to communicate them. You should obviously select this person carefully and make your wishes very clear in advance. The living will is a document that declares your healthcare wishes to be carried out in the event of a terminal illness or a condition where you are unable to communicate. These are two resources for you to obtain advance directive information, and you will receive these in your handouts today. You should always consider having an attorney check over these documents. This brings us to the end of this presentation. Your medical assistant will have given you a simple checklist and questionnaire corresponding to the preventive services covered in this video. You will have the choices of 1, giving us your consent to provide or schedule the recommended service, 2, letting us know you've already had the service so we can update your chart, 3, declining the service, or asking for more information before making your decision. If your answers regarding depression or tobacco use indicate the need, we shall provide you with educational material. This is an example of the checklist you should have. All that is required is your placing a check mark in the box of your choice for each category. In this first example, a red X is placed in the box that would authorize us to schedule a pap smear for cervical cancer screening. The next example shows a different choice by placing the red X in a box that indicates you decline or refuse a pap smear. The rest of your checklist would be completed in this very simple manner. If you have vision or other reading difficulties, your medical assistant will help you. We shall review this information with you and act on the recommendations and information in accordance with your choices. We hope that this video will have answered most of the common questions that arise and help you make the most informed decision possible on these critically important preventive health issues.